All right, you have a patient with juvenile myoclonic epilepsy. How do you treat? With valproic acid. If you have a patient that is on valproic acid, what two key things should you monitor? Thrombocytopenia and hepatotoxicity. What is a neurotoxin that inhibits acetylcholine release? Botulinum toxin, right? Is IV botulism immunoglobulin used to treat botulism? Definitely is. If you have a patient that has drama surrounding end-of-life care, what committee should be involved? The Hospital Ethics Committee. The Q-SORFA score helps with determining what? Determining sepsis. And if there's sepsis, you want to give them normal saline and broad antibiotics, right? Pearly penile papules. Are they a normal variant or are they abnormal? They are a normal variant. If you're talking to a patient, then you can say something like, we need to look at your medical condition. We need to look for a medical condition that explains your condition. Okay. If someone has CAH, what eponym is that? Addison's disease, right? And they'll have adrenal insufficiency. What is compromised when a certain population is studied? External validity, right? If someone's calling your clinic at an inappropriate time, what should you tell them? The office is closed, please reschedule. If a female has flirty, dramatic behavior, what personality disorder does she most likely have? Histrionic personality disorder. Is it ethical to date patients? Definitely not. It's unethical to date patients. If a patient has rheumatoid arthritis, what other condition would you expect them to have? Sure, anemia of chronic disease. And how do you treat anemia of chronic disease? Right, with the anti-TNF alpha. Thanks. How do you treat hypercalcemia? With IV calcium gluconate. How do you treat hyperkalemia? With IV calcium gluconate. You already said that. I'm gonna trick you. If someone has cardiac arrest, what should you do? Cardiopulmonary resuscitation, obviously. What indications are there to hospitalize an anorexic patient? If they're refusing to eat still, if they have suicidal ideation, hemodynamic instability, refeeding syndrome, or a BMI less than 15 kilograms per meter cubed. How do you treat refeeding syndrome? With oral phosphate. If you have an unconscious hypothermic patient, should you intubate them? Yes. If you have a hypothermic patient, what is important regarding their IV fluids? That it's warmed, right? You want to warm their IV fluids. If you suspect GBS in a patient, Guillain-Barré syndrome that is, what sort of imaging should you get? A spine MRI. If you have a smoker that smokes more or equal to 30 packs per year and they're between the ages of 55 and 80, What do you need to do for them? You need a screen with a CT scan. If you have a patient who quit smoking, how does that help them? Two ways. Decreases the risk of COPD issues and it decreases the risk of lung cancer. What sort of bacteria is most likely present with a human bite? Ay, canela. How do you treat Eikenella? Amoxiclav, right? If you see an image and there's honey-colored crusting, sometimes it looks a little bit slimier sometimes on the not so best pictures. What is that? Impetigo. If someone has benign paroxysmal positional vertigo, what procedure should you get for them? You should perform the canalith repositioning procedure. If someone has ALS, what do you expect them to present with? Progressive weakness in upper motor neuron signs and lower motor neuron signs. How do you treat ALS? With raluzole, right? Does amlodipine affect lithium levels? Nope. Amlodipine does not affect lithium levels. Postpartum preeclampsia, is that associated with hypertension and hyperreflexia? Yes. What is contraindicated? It's a common exercise. What is contraindicated in cerclage placement? Exercise is contraindicated in cerclage placement. Use valproate if a pregnant woman has a seizure in pregnancy and alpha fetal protein screen. Breastfeed if a patient is on anti-epileptics. If a patient is homebound and need a nurse, what should you do? Send them to home health services. If a healthcare personnel has a concern for TB exposure, what should you order? An interferon gamma assay release. What is the recommended medication, just like first line, very basic. What is the recommended treatment for someone with latent TB? Isoniazid, 9 months. 9 months. If someone has diabetes mellitus, is insulin a possible treatment? Definitely is. If you have concern for sickle cell disease in a patient, but it's not been, diagnosed completely, what do you need to diagnose it? Hemoglobin electrophoresis. Do patients have the right to refuse to know the results of their tests? Yeah, patients do have the right to refuse to know the results of their tests. Okay. Goodbye.